Today we continue our discussion on mental health disorders. We're going to be focusing on eating disorders. By the end of today, your objective will be to identify the dangers of eating disorders. Go ahead and take a moment and complete your warm-up. True or false? Eating disorders affect only females. Please explain your answer. Let's talk about eating disorders. Eating disorders are a mental disorder that reveals itself through abnormal behaviors related to food. Eating disorders are about emotions, thoughts, and the attitudes that a person displays. Now let's talk about anorexia nervosa. Based off of your definition from our vocabulary quizzes, you learned that it is an eating disorder where a person doesn't eat enough food to maintain a healthy body weight. They may feel that they are overweight and as a result will not eat what they should eat to maintain their weight. One of the main symptoms of anorexia nervosa is extreme weight loss. Some of the risks that are associated with this eating disorder are the overuse or the misuse of exercise or diet pills. This can have an adverse effect because it can affect your body by causing other health-related effects. It can also cause lack of essential minerals that can cause your heart to stop. Now, the causes, some causes include lack of chemicals in the brain that regulate a person's mood. What that means is that they may lack a certain chemical that could lead them to have low self-esteem. As mentioned, low self-esteem is another cause, as well as the desire to please others. An example of that would be maybe having a family member or a friend who is judging your weight or the way you look, and you want to change it so they would stop judging you. Other causes include past troubles as well, maybe troubles in the relationship or with friends. Some of the treatments for anorexia nervosa include encouraging the person to seek help. More extreme treatments can lead to staying at the hospital under medical and mental supervision. Now for your quick write, go ahead and click on the link in your notes, watch the entire video, and then summarize what the video was about. Then tell me what you've learned from the video. Now let's move on to bulimia. Bulimia is an eating disorder where a person has uncontrolled eating binges that are then followed by purging, or, as it's most commonly known, throwing up. Now, some of the risks with bulimia include dehydration. When a person throws up, they are essentially getting rid of a lot of needed water for their body. Also, they lack some necessary vitamins and minerals that are essential for a healthy lifestyle. It can also lead to kidney damage, and the acid that is in your stomach can lead to causing irritable throat and actually start eroding your teeth. Another risk from bulimia can be depression and risk of suicide. Now, some of the causes for bulimia are similar or the same as anorexia nervosa. However, some causes may be that people are using food to feel better emotionally. Maybe they are sad and they are eating so they can feel better. But in the end, a cause can be they purge because they are also concerned about their weight. Now, treatment for bulimia includes offering support in private, because most people who have bulimia would probably be ashamed that they have it. They may not be open to seeking help from a group of friends. So seeking or supporting them to seek help will actually need to be done in private. For your quick right number 2, please click on the video in your notes and answer this following question. What are some of the warning signs of bulimia? Please pause the video and do this now. Now let's talk about binge eating disorder. This is an eating disorder where a person has an uncontrollable urge to eat large amounts of food and then can't stop eating even after they are full. Now, some of the risks, like the opposite of anorexia nervosa, a person who has a binge eating disorder would actually gain more weight. And by doing this, they are putting themselves at risk for diabetes and high blood pressure that can later on lead to cardiovascular diseases. Now, some of the causes, maybe people will eat to avoid dealing with very difficult emotions such as anger and sadness and even stressful situations. The food can be a temporary relief to these emotions. However, once the emotions have passed, it can lead to guilt or even depression. Now, some of the treatments for binge eating disorders could be trying to eat slowly and eat deliberately, which means eat what you need to eat to continue and use up that energy for your daily routines. Another treatment can be seeking help from dietitians or mental health professionals. Please go ahead and click on the video in your notes and answer the following question. What are some of the side effects of binge eating? Take a moment to pause the video and complete this. Now for your closure. If you suspect a friend to have an eating disorder, what would you say to your friend? And how would you make them aware of the dangers? Please take a moment to answer this closure and don't forget to turn in your notes.